Welcome to Innovation Beyond the Chart, where we bring you real conversations with people behind healthcare's biggest challenges and everyday triumphs. Our guest today is Dr. Harlan Vanterpool, CEO and Medical Director of HOV Medical in the British Virgin Islands. Someone who's moved between public health and national insurance and now entrepreneurship. Here, we're not just talking shop, we're exploring what it takes to lead, adapt, and earn trust in small communities. By the end of this conversation, you'll hear real strategies on navigating the tension between public system demands and private vision, building trust and reputation from the ground up, turning constraints into creativity, especially with limited resources, learning from setbacks, and redefining what success means in patient care. So, if you're a healthcare professional, a student, or someone leading change in your own setting, this conversation is for you. In every system, in every clinic, people matter most. Listening and learning. That's how we move healthcare forward. Dr. Vanterpool's career stretches from public health and disaster planning to national insurance to launching his own multi specialty clinic. I wanted him on the show because he's lived both sides, public and private. He knows what it's like to take risks and rethink the rules. Let's jump in. Listening to you, Doc, I hear the constant tug of war between established public health priorities and your own vision for real preventative care. Can you bring us into a moment where you had to stand at that crossroads? How did you draw on your own strengths, read the situation around you, and then get others, outside your immediate circle to buy into your approach, even if it ruffled some feathers?
Yes. Well, that's a good question, Tim. First of all, I come from a varied background in health because I started off in public health initially. Um, Actually, fully trained as a public health officer and both public and environmental health. And that was my initial grounding in healthcare before moving on to actual medicine. I also did a bit of disaster management as well in between, and health disaster planning as well. All right, so my background and it's not only clinical but it's technical and a little bit of administrative combined. And in that journey, I have recognized quite a few different things, but oftentimes there's a big disconnect between primary and preventative care and tertiary and secondary healthcare, especially in our region. And with that disconnect between the two, you oftentimes have different conflicting or competing ideas of how the medical system should evolve, etc. And what things are important and what are the primary objectives that we need to get out of our health system. And because there's a conflict there, oftentimes the person's leading the charge, whether it be from on the hospital or the primary care end or the public health clinics or whatever, we have conflicting ideas a lot of times on what are the important things or the priority things to get us to where the system should be.
Yeah, it does feel like every leader faces that moment of, do I go with the flow or do I push for something better? How did that actually feel for you? That tension between system and self seems like it shapes the whole journey, for persons making this kind of leap.
So I've always had that conflict because primary and health care has always been the bedrock of health, especially in developing, especially in developing countries. That's the bedrock of any health system because that's
Yeah,
where you make
exactly,
the greatest
exactly. That's
impact
true.
in the communities. That's where you change people's attitude towards hypertension, diabetes, etc. And if we don't have strong primary health programs, we're always going to struggle in maintaining our hospitals, etc., because we're going to see quite a few things that come to the hospital that if our primary care system was robust, that those things would certainly be seen less. So I've always had that conflict because I see primary health care as very important. And despite being someone that has worked in both on both sides of the equation, I've worked in a hospital system where we see a lot of repeat things over and over, repeat offenders because they it's a cycle of going in and out. They're in cardiac failure or whatever it may be. Every couple of months, there's a hospital visit. They optimize a little bit and then they're sent back home. And that cycle repeats itself and in many different areas. And then that cycle of poor compliance that happens, etc. But again, in a system like National Health Insurance, which I was the medical director for several years, we are the payer essentially. And so the hospitals, the health system, whether private or public, they're the ones that are seeing patients. Oftentimes, they're focused on seeing their patients, giving them whatever care they deem necessary. Whether that care is just not taking the patient to an optimized position, but it's seeing the patient, settling their immediate issue, and then sending them back away again to come back really with more complicated and advanced complications than the issue with time. But the long term health management is poor, I would say, in most cases. So I have had to make a stand in making my transition to my own personal practice to go based on my conviction about what is the most important thing in healthcare delivery in my region. And my view is that the most important mechanism for proper healthcare delivery is to advance primary and preventative care as much as possible and even go deeper and focus on health and wellness for your patients because if your patients don't have a holistic approach to their health care, then oftentimes you're not going to address and optimize and give them the best medical services that you can possibly do.
It seems that that approach, really focusing on primary care, is a key one. Would you agree that focusing on primary care and preventative care instead of tertiary care, which is what we tend to do, would make health systems more sustainable, especially in the Caribbean?
And what I would say in addition to that, Tim, if we're going to make any health system sustainable, you have to certainly prevent where you can so that you don't have that high dependency on secondary and tertiary care. You limit persons going on dialysis, for example. Dialysis is an expensive undertaking, and the more persons that we have on dialysis, the greater the burden on the health system. We're in a region where persons have limited access to health services. We have limited and controlled access. We don't have unlimited source of resources and funds. So we have to utilize the funding and the resources that we have appropriately so that it can make the greatest impact.
Yeah, in the public sector, it can feel like you're navigating through a fog. That's been my experience anyway, with so many stakeholders and competing interests pulling in different directions. But in private practice, you might have a little more clarity, a straighter line from decision to action. What's that shift been like for you? Is it actually easier to make the tough calls in private care or private healthcare? Or do you find the same, or do you find new kinds of complexity? come up when you're no longer answering to the same big system?
Absolutely. So in the private sector, your decisions are driven largely on profitability, sustainability of an actual business. And so you're driven a lot by the business model that you're projecting, and you certainly set up your services, etc., according to the areas and the way that you see that you you would eventually grow your practice and grow your business. Whereas in the public sector has a lot of influence politically and other. There are many hands in the pot. There are different trajectories and different ideas and ideals, whether from the administrative people or the political arm of the health sector. We all have competing and conflicting ideas. And oftentimes you find is a clash of ideologies and what direction should be we go or not, especially if there's no clear national plan for the development of the health sector in that particular country. So it goes a lot according to the direction of the current leadership within the sector. And what we find, what I've seen regionally, is that if you don't have clearly defined health plans and structure as to, especially even determining what is the most important aspect of health development or healthcare delivery. So, are we focusing on primary and preventative care? Are we focusing a lot on just ensuring that the hospitals are equipped and are run and have the monies to just deal with very complicated and complex things? And certainly the latter is a formula for non-sustainability in healthcare because, as we can see, inflation in healthcare outruns or outpaces our ability to deliver the best care and the best quality and sustain it. So that's always going to be a challenge.
There's this idea that moving into private practice gives you freedom and clarity. You're not as tangled in as many competing agendas as you are in the public sector. But it's not that simple, is it? Suddenly, you're not just answering to policies, you're managing demand from patients, keeping an eye on finances, responding to changes that come at you at the speed of light. I wonder, have you found that even with the ability to make your own plan, you still have to keep an eye on what's happening in the public system? How do you walk that line between flexibility, being able to pivot and adapt, and not spreading yourself too thin, especially in a place where direction can be, lacking, growth can be slow, and resources can be tight? How do you decide what to focus on and what to let go of when building your services?
Yeah, that's a fact as well. Because the private sector still has to look at what is happening in the public sector while it's making its plans and adjustments, etc.
Right. So even when you're independent, you can't ignore what's happening across town or across the sector.
Fortunately for the private sector, the ability to pivot or switch or change gears is usually a little bit easier. And especially if you have a well-oiled machine that you've had, wide enough or you've carved out a big enough part that you can add on to that comfortably. So one of the things that you find, obviously, what a challenge in the private sector is when you set out to develop your model for sustainability, you have to make it wide enough so that you don't overextend yourself, but you still leave room for natural growth within the organization. Because if you limit yourself too much, then especially in our Caribbean region, where of course we don't have a population that will necessarily support consistent growth, and our population growth overall is very slow. So You're not going to, say, for instance, build your numbers just depending on population growth, but rather you build your numbers based on services and repeat customers and all of those things. So you have to have enough services that would attract your customers and keep them. So it's a different focus whereas in the public sector is the public sector. Usually their numbers are driven on being more cost effective than the private sector. So there's obviously usually a cost disparity and an access disparity. So in the private sector, the cost is usually more and the access is probably a little bit less because of the cost. So the public sector tends to be driven more by volume, whereas the private sector is driven more by services, quality of service, and being able to get repeat business and build a clientele based on that. So interesting enough, I mean that lends to a lot of competing values, of course, uh, and and those ethical dilemmas will creep in.
You've talked about the tricky ethical decisions that pop up, balancing what's best for your patients, what's financially possible, and what the community needs. So even though private clinics are businesses, they can't really ignore the values that drive public health, things like access, fairness, compliance, and building trust. How do you actually weave those public health values into the culture and the day-to-day decisions of your private practice? What does that look like when you have to balance the mission to innovate and grow with the responsibility to keep the care equitable and trustworthy?
Well, when it comes to that, I think there are a lot of similarities in which the private sector and the public sector must operate. Clearly, customer satisfaction and confidence is an important thing. If customers in the medical business or medical services, if they lose trust and confidence in your capability, for example, it usually means that that's not going to be somebody that's going to necessarily be a repeat visitor or a repeat customer. In addition to that, they usually will be negative for your organization because they're probably going to tell or say to somebody else some negative comment. And especially in a small region where word of mouth is one of the most powerful ways in which advertisement is done. We actually make or break a lot of the businesses within our own societies just by the word of mouth. And even despite all the different technology and so forth that we're exposed to, and then of course you have WhatsApp and these other technologies that can spread negative news even faster. So you have a major challenge on your hand, and especially in this digital world where so many of our customers, Dr. Google and Dr. whatever it may be, and they come in with yeah, preconceived ideas about how their management should go and all those things, and then, of course, so we have the challenge of facing these type of issues with persons that come in. So it's always an uphill battle now to actually provide that confidence for your patients because your patients oftentimes are in the office actually probably testing you to see how what you say compares or how you manage them compares to what they've read. So with
Yeah, it's wild how patients are coming to you now. Well, no, it's been for a while with all this information they found online, almost ready to quiz you on your own advice. It must really change how you build trust, not just with your medical skills, but with your ability to meet people where they are, even if their expectations are maybe all over the place.
yeah, exactly. So we're facing a very interesting time in customer satisfaction and building that reliability, etc. So it's even more challenging than ever. But I would say that there's some things that I always believe are very important. You have to have accountability in healthcare. You need to be as transparent as possible in whatever you're doing. Because if we're not accountable and not as transparent, then we can't build those confident relationships that we should be able to build with our patient in order to give them the best. If we're not able to have them completely bought into what we're trying to do with them in partnership, you're partnering with them to improve their health and wellness overall. So that is critical. And so both the public and the private sector, their ability to do that well will determine their ability to continue to maintain that clientele and to maintain that customer trust. So it's very challenging, but it's the crux of delivering quality healthcare to a willing patient base.
I keep thinking though about how trust works so differently in public and private healthcare. In public clinics, patients often stick around because it's the most convenient or only option. But in private sector, patients can be quick to look elsewhere if they lose confidence in you. Do you feel like the stakes are higher when it comes to public patient trust in private practice? Is it fair to say that compared to the public sector, even one bad experience could send a patient elsewhere? What have you noticed about how much more sensitive that trust relationship is when persons are paying out of pocket or have more choices?
Yes, that's my observation. That's correct. And and that's largely because the persons that are in the public sector and remain in the public sector are usually always going to remain in the public sector, whether they're constrained by their own resources, whether they're constrained by location or whatever it may be. Because, of course, the public sector, especially the primary care clinics, etc., sometimes are often located in much more convenient locations than your private doctors' offices and so on. So, for a number of reasons, yes, the public sector persons will probably remain loyal to that entity rather than going to the private doctors where people kind of with that ability to access a different level of care or certainly a different price point in care, they also usually are pretty keen on shopping around and listening to different persons and getting different opinions, etc. So yeah, in the private sector, I would say that you see a lot more doctor shopping than you would see in the public sector.
As you spoke about, what drives public versus private sector, I keep thinking about how in a small community, credentials aren't the whole story. It's who you are, how people remember you that really counts. Was there a moment when you realized trust wasn't just about being the most qualified doctor in the room? Did you, for instance, ever have to shift gears from showing skill to showing heart or just being consistent so persons would let you in?
Making a transition from what is known as a health insurance plan, like a national health insurance plan, where in that medium I had a voice to champion certain health causes. So I had an opportunity to help to champion things like preventative care, encouraging persons to look at their health and wellness more, etc. And even despite having that opportunity and having that voice, how does it translate to your personal practice and what your personal philosophy for health delivery is? is one of the things that you have to clearly step away or separate from. So, one of the challenges I've had is that when I'm speaking as the voice of HOV Medical, I still have some persons who still don't make the separation between my voice as a former medical director or whatever and where I am in my own practice. So that has always been a challenge. So I've had to spend a lot of time actually consciously making the separation and creating a new voice, a new persona, a new voice as HOV medical in my community. So we've started off doing quite a lot of community. I have a radio show um, called the Health Spot, which we're doing. I promote health and wellness in that show. My voice is heard in different things in community involvement when it comes to giving talks and lectures, men health, women's health, that kind of stuff. Also, what is important is to do health fairs, where again, pushing the main philosophy of what I believe is most important in healthcare. So that has been a challenge and a journey, but once you set your mind as to and defined your medical philosophy, that is what overrides and you move forward. So it's taking root and it's taking a bit of time, but patience, but it's going well.
That's actually a fascinating shift. Having to carve out a new identity after years of being known for one big public role. You're not just changing jobs, you're asking people to see you
Yes,
in a totally
absolutely.
new light. As you made that move, what did you discover about what really matters for earning people's trust? Was there a moment that you realized it wasn't just about reputation or expertise, but something deeper, like your own integrity showing day after day?
Absolutely. And I would say one other thing about trust. As healthcare professionals and practitioners, we always have to operate with the highest level of integrity. It's important. Or integrity or moral fortitude, etc., is often tested, and but you have to follow through because when you find trust is eroded, then that's a lack of trust. How can I trust my healthcare professional or practitioner if I don't find them accountable? I don't find them transparent, and they're seemingly more interested in making money from me rather than my own personal healthcare. So it's a delicate balance, and you have to strike it well. And even, but we do understand that in the private sector, it's still a business. And unfortunately, some of your clients may not realize it's still a business. There's still costs that you have to worry about, and you still have to pay the suppliers. You have to make sure that you are able to procure the equipment and the things necessary to give them the care that they're seeking from you. So it's, we constantly have to tweak, and that's the balance that you have to be able to strike effectively if you're going to be successful as a private practice.
You've done all this work to establish your own reputation, separate from your past roles. And you're clearly thinking deeply about trust and integrity in private practice. But it isn't just about your personal values, right? It's about making sure your whole team and organization live those values every day. Could you walk us through how you actually bring your core values like integrity off the page, out of your mind and your heart into real life at HOV Medical?
You have to build a culture within your organization, and you have to lead that culture building. And that's why I believe it's so important for every organization, healthcare or other, to have key core values, the things that you build your foundation on when moving forward. And at HOV, I have a couple of things that I I'm very passionate about as the core values for the organization. Transparency is one, and integrity is one, innovation, high level of professionalism, and we have to effectively communicate. We have to be able to do that effectively. So those are some of the hallmarks and core values that I emphasize for the organization. Because if we're not able to communicate well with our clients, we're not going to be able to build the relationships that we in turn coexist and empower the patient to live their optimum health and wellness. And that is what our ultimate goal is with the establishment of this organization. So I would encourage anybody that's building a practice, building whether in whatever area, to establish core values, what your organization is based on, what your organization stands for, and will always deliver in a consistent manner to its clients.
You've painted a clear picture of what your core values are, and I think the audience can really hear how important things like integrity and communication are to you. But in the real world, it's easy for values to become just words, nice words in a handbook, unless you can find ways to make them part of the everyday reality of your team. Can you take us behind the scenes? How do you actually put these values to work in practical ways, especially when it comes to how you hire, train, and even hold your team accountable day to day? Are there routines or moments where you see those values really show up in your people? Maybe in how you give feedback or recognize good work. I'm curious about how you spot the difference between just talking about values and actually living them out loud.
Yeah, well, that's a great observation because unless you inculcate it into your day-to-day operations, you're not going to develop that culture. So, for instance, in HOA Medical, we have established a company manual, and it lays out and it states the expectations in all the different aspects of the organization, from customer service to clinical management, how we take information, how we follow up, how we take appointments and organize all those things, right? And my expectation, I introduce everybody that's a part of the staff to this manual very early on. And our duty is to continually reinforce and certainly ensure that everybody's familiar with what their responsibilities are, their base responsibilities are, as within the context of the core values. So I expectation is that, for instance, if we have breach of trust, for example, over a confidentiality issue, everybody should know what the policy of the organization is when it comes to breaching confidentiality. You know, we've stated it clearly how to consent, how to do X, Y, Z, and these are the things that we expect or we would want to see. And there must be persons must be held accountable to those things. So, and it's not something it reflects on your performance because if you follow the core values well, then we highlight and we actually inculcate some of the core values into the performance evaluations. So we monitor those things to make sure that persons are actually doing well when it comes to that. The other thing is you want to have customer feedback, the satisfaction surveys, and the innovative ways to do those surveys now. We don't have to make them long and tedious things that people dread to. So you put them and you make them easier for the patients to fill out. You probably incentivize it a bit so that if they take the time to actually fill out the customer satisfaction surveys, it might come with a little incentive like 10% off or something like that. So you have to sort of be innovative because you want them to give their honest feedback so that you can make the changes that can improve your organization and make and grow your business ultimately. So you need you need to have the feedback, you need to have the yeah as well. And it also helps for the customer to feel a little more engaged in what is going on because if as I'm asking you to and telling you that when you come to my facility, it's a partnership that we're developing to for your health. So it's a healthcare partnership we're developing. The more that you can give feedback or the more that you engage in things that directly affect the practice, you feel a part of the family as well, and you actually feel that you're bought in.
You know, I could really picture that moment when a patient shares an idea or concern and then comes back later to see it reflected in how the practice actually runs. That's more than customer service. That's real partnership. It's kind of the experience, it's a kind of experience that makes people feel seen and valued, like they truly belong in the story of their own care, in the story of the organization. There's something powerful, about a patient walking in and realizing, hey, my voice mattered here. I imagine it must completely shift how invested they feel, not as patients, but almost as co-creators in the health journey. We've mentioned something that I really want to dig into here. You've mentioned integrity as a core value a few times, and I think listeners can really hear how much that matters to you. But there's something else I want to dig into that we've kind of danced around already in this conversation. In healthcare, trust doesn't come from just one thing. It's this mix of integrity, competence, and real care for the patient's well being. Some call it the trust triangle. I'm curious from your experience, especially in moments where trust is built or maybe even challenged, which piece ends up mattering the most? Is there one that when it's missing, you really notice the difference in how patients respond to you and your team? Or is it more about the way that they all show up together in a dynamic way?
They're all three very important things that you mentioned. Absolutely. But I know through experience that competence is one. It's probably the most essential one because at the end of the day, people come to a medical practice or to a physician because they believe that you're the person that has the answer. Whether or not they've looked it up in Dr. Google or online, etc., they're expecting that you're still the person that's going to be able to deliver that treatment that's going to be a change or game changer for them. So oftentimes I will get quite a few patients that come to me and said, I've been going to several doctors, and then this is very, very common. I've gone to several doctors, and you're the first one that told me XYZ. Or they would say, I've gone to several doctors, didn't get any relief. I came to you and I got not only relief, but I got some answers as to why XYZ is the case. So, what you really recognize is that persons are looking ultimately to see whether or not you know what you're doing, whether or not you're competent, and I think also being honest is important so that the patient doesn't feel that you're misleading them when you get to the point where you say, well, this one might be a bit beyond my scope. I think I need to send you to a yes, a specialist. Because I mean, some patients have the concept that all doctors are created equal and they know everything under the sun, and that's just not the reality. But you have to be able to guide them in an appropriate way, and when the time comes that there's something more, and you have an honest conversation with them and let them know, well, I can take you here, but there are some things, some experiences, etc., that I believe that a specialist in this area may be able to lend more insight and more competence to this particular concern. But definitely, competence is major. And I would say of the three, that's probably the most pivotal one.
Uh, you know what's fascinating about all this, especially in healthcare, is that even though competence is so central, most patients aren't really able to judge a doctor's technical skill directly. Instead, they pick up on other signals, even if they don't realize it. The thing is, humans have an interesting way of evaluating competence that isn't actually, or often isn't actually, aligned with actual skill. Sometimes it's confidence, sometimes it's humor or empathy, or even how relaxed the doctor seems. A lot of these things have become stand ins for competence or technical know how. I'm curious, have you noticed patients using these kinds of signals as proxies for excellence? And do you think it's even possible to get patients to truly assess clinical skill or to bridge that gap between those proxies and actual skill?
That's an interesting comment. Uh, Oftentimes, I mean, we found this that patients love bedside manner. The physician that comes in and lights up the room with his charisma and charm, they just love that. They eat it up. Oh, and they you connect with them, you talk with them, and you make them feel good. And you may have not done anything for them in terms of actually delivering advanced care, but the care that you delivered for them is to bring a smile to their face and to make them feel good momentarily. How does that translate to being an effective physician? It doesn't always translate to be an effective physician, but your patient has satisfaction nonetheless. And they're saying to themselves, well, I like Dr. Jones. I just like the way he deals with me. I love it. I've not seen him.
Yeah, well, they actually go further to say, this doctor definitely knows what he's doing.
You know what he's talking about. Despite the fact that my feet are still as swollen as they were when he started seeing me, and I see no change. I like this guy, so I will continue to go. Yeah, I mean, we have that happens a lot. That's a lot because the feel good phenomenon, and there's some patients who just want to have a discussion with the doctor and feel good and feel like. But again, that's the opportunity for those doctors to develop that trust, that partnership, that unique relationship that, because now they have that such a confidence in you. What you have to do now is to then mix that confidence with the competence to be able to deliver what that individual needs. So, I applaud doctors with excellent bedside manner because you already have the gateway to the patient's overall wellness and improvement. Because once you develop that rapport, then you hold the keys to getting that individual to actually completely change their health and wellness.
Harlan, I find this really fascinating. I think listeners will relate to. We've been talking about that feel good connection, how it can sometimes win patients over, even if the technical skills and the competence behind the scenes are harder for them to judge. It's like, some people just light up a room, and it's easy to see why patients stick around for that bedside manner. But, there's another side to it, right? Not every physician is going to have that big personality or that instant charisma. And honestly, I've seen patients who are also drawn to a quieter, steadier kind of doctor, someone who listens deeply or takes their time, even if they aren't the most outgoing. So here's where I want to take this conversation next. Have you found that it's possible for a practice to intentionally design the patient experience, maybe through the support staff you hire or the way that your office runs? to bridge those gaps in personality or charisma? Is it about finding ways to make sure every patient feels that connection, even if the doctor's style is more reserved? Or is there always a trade off? I'd really love to hear how you think about building that sense of trust and warmth across your whole practice, especially for those of us who aren't natural extroverts.
Very good question. I like that question very much because it comes down to having a couple of things in your toolbox as any physician or any provider or practitioner in when you're dealing with your clientele or your patients. Um, Not all of us naturally are going to be as charismatic as the next person and able to naturally have that ability to connect with that individual. But there are some things that we have in our toolbox despite not necessarily being the most charismatic. The ability to listen is key. So we have to be able to listen to the patient. This is one of the number one complaints that I get with persons who jump from doctor to doctor to doctor. One of their complaints is always, well, I don't think my doctor is listening to me. So I had to get another opinion from somebody else. So that's number one, being able to listen to your patients properly and understand where they're coming from. You have to demonstrate as well that you're listening. Not just say you're listening, but be able to demonstrate it. So if somebody is in your office and they're saying XYZ, what I like to do is I like to regurgitate or reverberate to them the key things with what they told me, just to make sure that they understand I have been listening to what they're saying as well. And I find that that builds a good rapport. So in my history, I then go back and say, so in speaking, we said earlier, these are the key things, and I make sure that I state those things. That's a one way to reinforce. And another thing that I do, and I think is very effective, is to share insight with the patient. Meaning, whether you give them a little key, it's some experiences that you've seen, things are related to a real life situation. So if you're describing to a very, you know, layperson, what it means to have a heart block, and you're not able to break it down and ascribe it to a pipe and plumbing and that kind of thing, then that person will probably tell you that they understand or understood everything you said when they're in your presence. And the minute they walk through the door and they tell their friends or they tell their loved ones, I don't understand a thing the doctor told me. So that ability to share insight and share stories and to make connections that are real and they're connecting with the patient is another critical element. And if we could do some of these things effectively, then it then opens up the communication between you and the patient properly. And that is what you want. So patients you have to listen, you have to demonstrate that you're listening, you have to share insight, etc. And the communication then flows. And then 99.9% of the time, we can actually determine what the real problems are with our patient.
So I think it's very encouraging about what you just said is that, these skills, really listening, being present, and sharing your insights aren't just reserved for the outgoing, naturally charismatic types. Even if you're on the quieter side, you can still build those bridges with your patients. It's about how you show up, how you respond, and how you let people know they've been heard. These are things
Absolutely.
that anyone can practice and improve. And actually, sometimes it's these quieter strengths that end up mattering most. It's not about putting on a show, but making sure people feel that their concerns are seen and heard. Would you say that in your experience, those foundational communication habits sometimes even carry more weight for patients than just being having a friendly vibe or good bedside manner.
Absolutely. Absolutely. These things are probably more important to the patient than just making them feel good because if they feel that they're being listened to, they feel that their problem has been articulated and they have reasonable answers to why and what, then it's more likely that you're gonna get compliance with the game plan. And moving forward, you're gonna get their cooperation in the future. So that definitely is a way to make the connection with your patient.
I love how you're highlighting that real connection isn't just about making patients feel good in the moment. It's about helping them feel understood and heard so that they actually trust the care plan and stick with it long term. But I'm curious, do you find that patients are actually picking up on these deeper things we're discussing, or is it still mostly the charisma that draws them in? Uh, because in business and even in healthcare, we often see leaders who are outwardly charismatic get tagged as the competent ones simply because of how they present themselves. But some of the most effective leaders and clinicians I know are quieter, more reserved, but still build trust through presence and listening and empathy, as you've laid out here. So it's very possible that these enduring characteristics are present in both the extroverted and introverted clinicians that happen to build trust with their patients. So in your practice, do you notice that patients are truly responding to those quieter foundational habits like careful listening, honest communication, even if the doctor isn't especially outgoing? Or does charisma still have the edge when it comes to first impressions and trust?
Yeah, I would have to say yes. They're they're actually probably demonstrating those things, and and that makes a difference. The charisma initially will be the thing that would break the ice and put the patient at ease and maybe open their communication faster. So I would say if you were charismatic, you would probably get to the point of open communication a bit faster than the person that is not so charismatic. Yeah, but you can still be just as effective in either way once you're doing the things ultimately and demonstrating that you're listening and demonstrating that you're actually connecting with that patient on that level. Yeah.
So the long-term partnership is really built on that, the listening, the insights, the connection, rather than the charisma.
Yeah, absolutely. Absolutely. And that's it. The healthcare partnership, I call it, that's important. That's very important.
We've been talking about the importance of building trust and connection. But the reality is, even the best vision can get sideswiped by factors you never saw coming. In entrepreneurship, in healthcare, you can dream big, but the world often has other plans, whether it's regulations, staff shortages, or sudden shifts in patient needs or technology. I'm reminded of that Mike Tyson quote: "Everybody has a plan until they get punched in the mouth." All right. Have you had a moment in your journey where your ideal vision for your practice hit a hard wall, where you had to pivot, scale back, or completely rethink your approach? Can you take us into one of those moments? So, what did that collision feel like? How did you adapt, and what did you learn from that experience that's still shaping you today?
Oh yeah. Oh yeah. Every day. That's one of the constant challenges you face. Well, I'll share something with you, Tim. The vision for opening this medical practice, I've been fine-tuning and working on it since 2012. That's more than 13 years ago. And I've changed, I've tweaked, adjusted the business model in many, many ways to because healthcare is such a dynamic thing. It's ever changing. It's shifts here and shifts there, and you just have to be able to make those adjustments in a timely manner to stay ahead of the game. Um, so we've had a major hurricane in 2017. Um, so I'll give you some further insight. Um, I had a good friend. Him and I were co-partners on the initial vision for this clinic. Unfortunately, he passed in 2015, thereabout. No. He unfortunately passed. So we started out together with different interests, but we had a plan. So we had a hurricane, major hurricane in 2017, which of course derailed some of the vision or the initial plan. Then unfortunately, not long after that, he passed. And so I had to completely revamp the vision that would scale it down to what I can manage in my vision board, right? Then we had COVID 19, and the concept completely changed because I delve and jump right into concierge medicine in a much more in depth way. And then, of course, it blossomed into starting to deliver telemedicine consultations and then viewing the way that medicine is shifted. Because if you would really realize that the the way that healthcare is being delivered has shifted tremendously since COVID 19. Lots more. Yeah, yeah. So absolutely. So we all recognize that the game has changed, and so there there are major hospitals that are closing, in, for instance, in the United States and other places, because you just don't have that volume of patients coming to hospitals like before and different things like that because certain services can be delivered as an outpatient just as effectively. There's continuous monitoring, there remote monitoring for things like your blood pressure and all these things, and doctors can give you an opinion because they're able to upload information in real time about you. And yeah, so just saying all this to say that there's never one set game plan, despite you having an effective business plan and an effective vision and whatever. So it still comes down to your core values, your core vision, etc., what you're trying to achieve. But you're going to tweak the model as you go along because you have to stay ahead because there will be some dynamics that will change. From things as simple as a change in government to a change in climate change to not being able to recover from a disaster. Disasters change the trajectory of healthcare a lot as well, you know. So there might be all of a sudden a disaster happens and then there might be an upswing or a demand in a particular area of healthcare where you're not focused on, but the necessity is there, the need is there, so you're saying, well, I have to provide that service because the clients that are coming through my door, I can't say to them, well, we can't provide that service and keep sending out. So again, that ability to adapt to change, etc., is very critical for any developing medical practice or service.
As you're sharing these stories, I'm reminded of Jim Collins' book "Built to Last," where he talks about this exact challenge: how the most enduring organizations don't just stick to a rigid plan, but find the balance between holding on to their core values and constantly adapting to survive. In healthcare, I must admit it does feel a bit more urgent. Whether you have hurricanes, the passing of a partner, a global pandemic, you have to know what really matters at your core: your values, your mission, your commitment to your patients, their health, and their well-being. And also be able to shift gears when reality hits. That dual focus is what keeps the practice relevant and resilient and of use to its patients, no matter what things pop up or come through the door.
Absolutely. Absolutely. There's no doubt about that. You have to be able to have that shift. And, it goes, so many ways we have to look at how we develop a business. A good friend of mine like to say several ways to skin a cat, but it's still skinning a cat. And so you have to. So, for instance, Tim, artificial intelligence (AI), that is going to obviously arguably be the greatest game changer or the fastest game changer right now in the delivery of healthcare. Already is, and and so if you're not going to move your practice into that direction, then you're gonna lose. You're gonna have to decide whether or not you want to remain traditional or you want to grow. Because your newer patients are certainly going to move to the direction of more convenience. And let's face the fact, pretty soon, lots of people are going to not, if they can avoid coming to the doctor's office, they will. They will. And so practices have to consider whether or not they need the space that they normally would have delivered. Because if you're seeing 50% of your patients who don't even ever come to the office, is that going to reasonably be able to sustain you having a big office with many rooms and that kind of stuff when you're actually contracting your need for physical space? So that's a consideration. That's a business adjustment that you may need to make.
All this talk about adapting to new realities in healthcare and artificial intelligence reminds me of a session I recently led on patient safety and artificial intelligence. One thing I emphasized, drilled in with that group is, and I think it really resonates here, is that even as we bring in all this new technology, uh, the fundamentals do not shift. Uh, no matter how much AI advances, we still have to put patient safety, ethics, and autonomy at the center. Those are the core roots and they don't change. And, as we start using the new tools, AI, telemedicine, whatever is next, the challenge is making sure that those values actually show up in how we deliver care, not just as slogans.
Absolutely. Absolutely. Yeah. And one of the things I would say, Tim, in delivering and meeting your goals, etc., you want to be able to meet your goals in the most effective manner possible. And we have to be real. The As a result of COVID-19, for instance, we've lost a lot of healthcare providers in various systems across the world. Therefore, there's more burnout because there's higher demand on fewer physicians, and you're seeing more burnout than ever before. So you really are finding that a number of physicians who would have filled the gaps are now leaving the system. So it's even getting more and more difficult to find the needed specialists, etc., that you would want to have access to. Um, Systems such as the ones that we would see more in the Caribbean would be heavily reliant on your general physician. Your general physician is going to certainly, the more that they're upskilled to handle a broader, effectively handle a broader number of ailments, etc. That's a plus. but they must be able to handle the core things well, so that they could then, in some cases, be remotely supported by specialists who can consult in a telemedicine manner, etc., and you still execute the day-to-day management of the patient. So that's a model that you're going to see being adapted more and more and more and more, and especially as access of providing healthcare access in remote areas of the world becomes more integrated. Because whenever I look at the systems that are being employed, say for instance in remote islands in the South Pacific and areas of the world where they just don't have every resource or every specialist available, but they're still being able to effectively meet all the demands and manage through things like telemedicine and AI and all these other tools that we're utilizing. And of course, soon you have robots with the ability for persons not even in the same area as the robot to do remote surgery. So the technology is changing the way that you're going to have to deliver care. But what you don't want to lose sight of in all the technology is that human element, that connection with the patient, that really enables you to still be able to determine what exactly is going on with your patient for better and more effective management.
Harlan, as we look into these emerging technologies from AI to telemedicine and even remote surgery robots, all right, sometimes it feels like we're stepping into the future at full speed. But what really stands out about how these advances aren't just changing big hospitals in major cities, but they're really opening doors for communities that never had this kind of access before, as you said. But here's what really fascinates me. As all this technology bridges gaps, it's also shifting boundaries between generalists and specialists. I was reading recently that AI is starting to blur those lines, not necessarily in medicine, but in other knowledge-based work. But we could see how suddenly a GP can actually offer insights or diagnostics, like with an AI-powered retinal scanner for diabetic eye disease that used to require a specialist. So it's not only about connecting patients to care, which is the core of it, but it also expands what's possible for every practitioner on the front lines. Still, all of this innovation brings its own set of challenges, like stable internet, equipment, making sure the technology really reaches the people who need it most. But it does feel like we're at this crossroads where the tools we have are changing not just how, but who can deliver care and what that care can look like.
Yeah, that's absolutely true. That's absolutely correct. And, in our conversation about the challenges facing developing practice in this modern era, especially in a place like the Caribbean and where we in remote small island development states, etc. Those real-time challenges what we have, because just like we may have challenges with access to the technology, we also have challenges with stable internet platforms and all these type of things. And again, if you're going to be able to effectively deliver that kind of healthcare, you have to have stability in those other areas. And those things are largely not necessarily dependent on the practice itself. There are a lot of outside factors that have to be available to provide that. And then, of course, I always say, in disaster prone areas, such as where we are, continuity after post disasters or with the interruptions, that's another major, major, and that can impact a challenge, right? And that could also impact your business significantly, because if you're not able to, meet the continuity as quickly as possible, get your systems back online, etc., and you're moving forward. Especially if you're AI and technology-based systems, then you could easily run yourself into lots of challenges and trouble.
Uh, so what you said earlier about having to rework your vision after losing your co-founder really stuck with me. But I imagine it's not just those big life-changing events. There are smaller disruptions, I'm sure. Shifting patient needs, changes in the environment that force you to adapt all the time. In those moments when you have to make adjustments on the fly, how do you keep your core values, as we were discussing before, and your team's sense of purpose intact? How do you make sure that the quick changes don't throw off the philosophy or direction of the whole organization?
Um, Healthcare leadership is always going to be challenging, simply because you can may set philosophies, etc., core values. You sell that to everybody that's following you, and they understand those are the core values, the principle that you're building everything on, etc. But they also can get confused when there's times that shifting becomes necessary. So you have to be careful with any shift in philosophy or shift in dynamics that occur, that it doesn't shift the philosophy of the organization, because those organizational philosophy shifts can also bring changes to the way that your staff and the people that are around you that are following your leadership interpret it. So there could be mixed thoughts, and that's something that you now have to work to fix, to return to that state of equilibrium so that it continues to move along. So you have to be careful that you don't pivot or shift gears in a manner that disrupts what your leadership style is and what where you've been leading the organization. So it's a delicate balance. Uh, One of the things that I've seen, and always have to engage your team at some level so that their voice, that you don't become the only voice that's leading the organizational charge, so that when there are shifts and changes, etc., everybody understands, well, okay, it's not just the one voice that I'm hearing that's shifting, but the organizational voicing, the messaging for the whole entire organization. And it's what I was saying, that that message is carried throughout the entire organization. That is key. That is critical. And of course, that's why you have business plans, that's why you have operational plans, you have different things, but that's why they need to be updated and tweaked and etc. And that's one of the things you have to make your the persons that you're leading understand from day one, that despite the fact that we actually have a plan, which is the plan on paper, the day-to-day changes that we may affect or that can occur, etc., we have to have the flexibility to make changes as dynamics dictate. So that is one of the things that we have to be able to do. The other thing you don't want to be caught up in as well, you don't want a situation where one or two individuals completely cripple your organization if something adverse were to happen to them. You have to be careful with that. So you don't want all the institutional knowledge to be vested with just one or two persons. You need to be able to develop a team effectively that still multiple persons can assist or fill in or be able to fill the gaps that may occur because if when we get gaps in healthcare, if we leave them unfilled for too long, it means that we can lose that ability to maintain that business line, for example. So we have to make redundancies and contingencies available, readily available to meet those gaps when they occur.
Yeah, so you really touched on something important here. It's easy to underestimate how vulnerable a practice or any business can be if all the knowledge or key responsibilities are concentrated in one or two people. If something happens and they're suddenly out of the picture, the whole operation can grind to a halt. Um, so, building in redundancies and making sure your team can step in to cover those gaps becomes essential, not just for business continuity, but to protect patient care as well. The same goes for leadership. A lot of owners want to make every decision themselves, especially when their own money is on the line. But real resilience, real durability, real creativity and innovation comes from empowering the staff and making sure everyone is on the same page. That's not easy work. It takes time, trust, and a real effort to create a shared vision that people actually buy into. What a lot of leaders default to is this shortcut where rather than doing the work of building a shared vision, building a shared culture, they just make all the decisions themselves and bypass that exercise. But from what I have seen, the best run organizations are the ones where you could walk into any department or any unit and hear the same values and goals echoed, no matter who you're talking to.
Absolutely. And that's part of the reason why some people shy away from it as well. But the best ran organizations I've come across have always had the ability to get buying right across the board, and the philosophies, etc., permeate throughout the organization. So that if you go into different departments, you talk to the leaders in those areas, they're still talking with the same vision. Uh, yeah, and that is critical, because if your organization, the bigger it gets, becomes less and less connected, it's not going to be an easy thing to manage. It gets difficult to manage. It loses sight of its core values, and pretty soon, what you're building, as fast as you build, you will be eroding the same product that you're actually trying to fine tune. So you have to be careful with not doing that. Yeah. So you have to build the right way if you're thinking about being sustainable. You have always have to build in the right way.
Exactly. And I think that's something every founder struggles with as their practice grows. It's one thing to build a team and get buy in when you're small, but as things scale up, it's all too easy to lose that connection, to start drifting from values and standards that made you successful in the first place. Suddenly, you can be growing so quickly that you end up diluting the very thing that you're trying to build. So it sounds like as much as growth is important, it has to be the right kind of growth, measured, thoughtful, and always anchored in your core purpose. With that in mind, something has been coming up throughout our conversation, and you're in this unique position where financial results and patient outcomes are always intertwined. As someone who has worn both the clinician and entrepreneur hats, how do you actually define growth and success for your practice? And has that definition changed as you've grown and the landscape has shifted?
Uh, well, I have a vision, a mission for the organization, a primary goals, along with core values. Right? And my overall vision is to, once I'm seeing where we're actually changing the trajectory of people's health and wellness, meaning that that sells itself, because the way that you're able to impact individuals and change their health status, it is a definite joy. But not only that, I think that sells success to the persons that visit your clinic. If you are successful in changing the health trajectory of those persons, and they can see it, they can, their HbA1Cs, their hypertension is all but literally uncontrolled. They're on minimal medications. They are not on any medication in some cases. When they presented to you, they want five. So when I'm seeing that type of thing, and they're completely changed, and they're convinced that yes, that medical practice has done what it's supposed to have done for me. It lived up to its promise to partner with me in the health journey. That's a measure of success for this organization. I always say, once you're able to be consistent, give people what you promise to give them, then money comes. Money is not the primary driver. It comes with success, it comes with production, it comes with all the things that you put in place. And then how you maintain that is to manage the business aspect of it well, right? So you shouldn't overmanage the business aspect, because you're not, well, you should not take away from the clinical aspects because you poorly or mismanage the business aspect. So it's a delicate balance when you're doing this kind of business. Manage the business well. It's a business, yes, and ensure that that business, you have the people that are competent to manage that part of it well, but do not let it disrupt the clinical management of your patients.
Absolutely, absolutely. Managing a clinic isn't just about providing care, it's about building the right team, putting systems in place, and making sure that the business side doesn't get in the way of good medicine. That balancing act is crucial. But I want to bring it back to the heart of what you do. Throughout this conversation, you've mentioned how meaningful it is when you see a real shift in a patient in a patient's health. When something clicks and their trajectory changes for the better. Could you share a specific moment or a story where you saw that happen, if you could, or one of those times that reminded you why you do this and what all the hard work on the business side really is for.
Well, one one of the key things I would say, um, I believe my philosophy is this: early detection, early understanding of what are the complications a patient is being faced with, etc. These things matter. So even with ensuring that thorough annual physicals are being done. So I have been able to discover very early on in some cases, just by being attentive and being thorough, to finding early stage cancers, to be able to manage the person before, with their hypertension and the diabetes, before they've really gone into full blown need for full medications. So even if we've been able to put them on medications temporarily, we have been able to get them to the point where we can actually stop. I've had one or two patients where when they came to me, they were extremely uncontrolled. Some of them are diabetic, some of them are hypertensive, and some of them have gotten them to completely stop medications and being able to control doing lifestyle changes, diet and exercise, and of course we monitor and we follow them up so we know that they're actually doing quite well. So again, I've seen the power of the partnership with the patient be effective for their management.
There really is something powerful about those moments when a patient's whole trajectory changes or shifts because of that ongoing partnership. And I think what stands out from our conversation is that healthcare goes beyond just clinical outcomes or the financial side. There's also a third element, the social impact. Healthcare organizations play a big role in improving the communities that they serve. I've heard about your involvement outside the clinic, giving talks, running health fairs, engaging the community. That social responsibility really rounds out the picture. So it's not just about managing the numbers or focusing on the patient in front of you, but also being present and active in the community.
Absolutely. Spot on. That's a third and critical arm. Yeah. You know, a lot of people focus heavily on marketing, especially with all the new ability we can market on Facebook and all these different types of things. But we also recognize that radio and the listening communication by listening is still a major part of communication in our region. Lots of people still, that's what they hear. So the younger generation may be technology savvy and doing these things, but the core of your persons that will frequent or your service would probably not necessarily all be on that same trajectory. Yeah, so you have to be cognizant of that. So you have to still, if you want the message to reach, you have to make sure that the message is going out in the medium that is actually reaching the masses. So healthcare promotion and all that has to take on a new or at least a broad-based approach to be as effective as possible.
Absolutely. And I think that's a great note to end on. Harlan, thank you so much for taking the time to share your experiences and really open up about the challenges and lessons you've learned along the way. Uh, you've offered so many practical insights about building a practice, staying rooted in your values, adapting to change, and making a difference in your community. I know there's a lot here that listeners, whether they're students, healthcare professionals, or managers, business owners, or anyone interested in what it takes to lead, can take away from this conversation. I really appreciate your honesty and your willingness to walk us through both the tough moments and the rewarding ones. Thank you for joining me and for everything you're doing for healthcare in the region.
Oh yeah, you're most welcome. I just want to say one last thing in closing, Tim. You know, the level of success. How are we going to measure our own success? Well, for sure, we have to make some sacrifices. There's no doubt about that. Anybody that's going to open a practice or open any kind of service has to make some sacrifices. They have to put in the work, must be put in some work, and it might be a lot more work than you even imagine. But then there's there's the point that you would get to the rewards, and the rewards are usually the satisfying part that makes it all worth it. So I encourage any young entrepreneur to get into your practice, etc. Define your philosophy in healthcare. Know what you want to achieve for your patients, what you want to achieve, and what impact you want to make on health and wellness in your region. And then you build your vision around that, work hard, and then the rewards will come. Just stick with it. You'll get through.
Oh yeah, that's so true. And before we wrap up, I just wanted to also add from my own work with organizations, one of the biggest differences I see between practices that thrive and those that struggle is the presence of strong systems. Building a practice isn't just about having the right people, even though that is extremely important. It's about creating reliable processes and structures that keep things running smoothly, even when you're not in the room. So, like you mentioned earlier, in having things like operations manuals
Yeah,
means
absolutely.
you're not
You
constantly
got
making
it.
every decision yourself or getting buried under paperwork. It frees you and your team to actually focus on patients and what really matters. Without good systems, or all the rewards and satisfaction from your work can get lost in stress and chaos. So, whether you're just starting out or growing your practice, investing in the right systems is key. All right. Thanks again for your journey, Doc, and your insights.
No problem, Tim.